This is a video highlighting the therapeutic effects of short-wave diathermy. Here we have a student physical therapist performing a skin check and a sensation test. We're using the hot-cold sensation test because the short-wave diathermy is a therapeutic heat modality. General contraindications for heat modalities include application over areas that lack thermal sensation, areas of vascular insufficiency, areas of recent hemorrhage, areas of acute inflammation or infection, areas with recently applied ointments, areas of no malignancy, and lack of communication between the PT and patient. Specific precautions of using short-wave diathermy on a patient is if they have an IUD with copper, using it over growing epiphysis in children, obese patients, near other electrical medical devices, and low back pain of women who may be menstruating. Contraindications include using it when any metallic objects are in the field or embedded in the body, pacemakers, pregnancy, using it over joints/organs, and using it over synthetic materials. I want to take a moment to talk about the type of shortwave diathermy we're doing today. There are two types, capacitive and inductive. We are doing inductive shortwave diathermy, which is when a single drum, like shown in the photo, is being used, and it has greater healing in skeletal muscle and blood and lower heating in skin and fat. Capacitive, two plates are being used, and it is better for superficial tissues/joints. The usage of this type of modality is indicated when needing to heat deeper tissues, heat a larger area of tissues, has less risk of burning soft tissues than conductive methods, improve joint or soft tissue mobility, reduce pain in the OA, sprains, and PID, and using it when the patient has shingles virus. I also want to point out the different dosage levels for shortwave diathermy. The typical duration is 15 to 30 minutes. There are 4 dosage levels. Dose 1 is non-thermal with no rise in tissue temperature, so there is no watts, and the suggested clinical use is for acute injuries, edema reduction, and cellular repair. Dose 2 has mild heat sensation. It increases the temperature of the tissue by 1.8 degrees Fahrenheit or 1 degree Celsius. It is at 12 watts, and it is used for subacute injuries and inflammation. Dosage level 3 achieves moderate heat sensation. The tissue temperature rises 3.6 degrees Fahrenheit or 2 degrees Celsius. The average watts to achieve that is 24 watts. The suggested clinical use is for pain, muscle spasm, or chronic inflammation. Dosage level 4 is to achieve vigorous heating at 7.2 degrees Fahrenheit or 4 degrees Celsius. The average watts to achieve that is 48 watts. Dosage level 4 increases blood flow, and it uses heating of collagen to achieve soft tissue stretches. In this video, we are going to be using the average watts at 15 for a dosage level of 2 to achieve mild heat sensation. We're using a continuous shortwave diathermy for this, set at 20 minutes. Here we are performing a skin check post-use of shortwave diathermy to make sure there is no adverse responses.